Hi everyone, I'm Gina and I am president and founder of Forme, as you guys already know. And we're here, Facebook Live, with my partner Maria. And we're having our first IV drip of vitamin C and B complex. So they did my IV first because I have very difficult veins. And so you didn't get to see them inserting my IV, but right now they're about to start Maria. And Maria's saying very calmly,
hello everyone. So reflect and reset again
with
back. Maria and Gina. We are so happy to be back live with you. You can ask us any questions. We're going to be talking to you about many different benefits of vitamin C and vitamin B complex. And like Gina was saying, we happen to have I think I'm going to have to be quiet because they're going to insert my IV right now. So Gina, take it over.
So I'm watching the needle go. It's very exciting when you watch it on somebody else. But anyway, so they did mine, and you can see my drip is starting. And it's going to be probably about 45 minutes from start to finish by the time that the entire packet is in my bloodstream. And very, very excited about it though. So all the benefits, and Dr. Middleton is here, so once Maria's all set up, we're going to talk to him about all the benefits that we get from these.
You want to talk about the PRP and the combination of the vitamin C and B?
So you mean doing these first?
Right.
So what we have discovered is that by actually doing the IV first a few days before that you do any PRP, it takes better. So when I go and on Wednesday when I have my PRP done for my face, they were telling us to please do the IV first to be able to get all the nutrients that our body needs to be able to absorb your own plasma.
And what Sandra was saying is that you create more collagen, which I didn't realize from when you have these vitamins. So when you have the PRP, the plasma, the platelet-rich plasma, it actually gives you better results and your skin looks more radiant. So that they suggest that you have 2 treatments before you have the platelet-rich plasma. This is our first treatment. We're very excited because one of the benefits is that it gives you a lot of energy. We, as you all know, work extremely hard, fulfilling a mission that we are so committed to, and sometimes you get exhausted. I mean, the hours that we work are very long hours, and it is, this is a benefit that we're looking forward to feeling energized. So we have Dr. Middleton, our medical director, and internal medicine at Forme Medical Center. And Dr. Middleton actually does some work at our Transforme, and we are at Transforme MD. This is where we get the IV treatment. And Dr. Middleton was kind enough to join us to talk to you about the benefits of vitamin B, and vitamin C.
So we give these now as IV fusions, and vitamin C is a very powerful antioxidant for starters. So it's really good to help boost the immune system. It can lower your chance of heart disease. It helps mood. It helps absorption of iron. So there's a lot of really good benefits to getting it. And vitamin B complex can help with your mood, mental alertness, mental fatigue. It also it can be good for the defenses of the body. So they lower uric acid, as a matter of fact. So there's a lot of good benefits to these vitamins, and as you said, they are proven to help with the skin.
That's great. And let me ask you, what is the age? Is there a certain age that you should be getting this treatment or not?
No, any age, anyone who has, I guess, it feels that they want to try a vitamin to help other aspects of their life, certainly with fatigue, alertness. Like I said, if you think you're getting sick a lot, and these vitamins can certainly help. There's no real age to it. We
That's
certainly do adults. I mean, we always recommend that you be an adult. That's who these are primarily made for. So 18 and above.
Okay. Well, you can take your gloves off. So the other question I was going to ask you, how long does the procedure normally take? I know that some people say 30 minutes to 45 minutes.
It depends how fast the drip is going. So, I mean, this would probably take about half hour to 45 minutes. The most it ever would take is an hour.
And are there any side effects?
You feel great. That's the side effect. No, there are no side effects at all. Absolutely not. There's no such thing as an overdose. At the end of the day, these are vitamins, and no, there's no overdose, and there should be no side effects except that you feel better, more alert, better mood.
That's great. And as far as allergic reaction, could anybody be allergic to this?
No. I don't think there's any allergy to vitamin C or vitamin B complex. It just doesn't exist. Your body needs these.
And I know that this is something that actually is like a trend that is happening. I know that a lot of medical practices, a lot of doctors are doing the vitamins complex, and they mix even when you go out. So what I heard, that there are people that if they have a hangover, they could get a combination of certain vitamins, and they actually will feel better.
Yeah,
almost instant.
That's true. As a matter of fact, sometimes if we do treat people in the emergency room, they will often get something similar to what we're giving here.
Okay.
Yeah.
It's a big business. Gina and I were actually looking. We were thinking in the Mamaroneck Avenue here in White Plains, they have all those bars.
I know, the hangover bus.
Yes.
Bring the Vegas hangover bus to White Plains. Because some of these kids, they need it.
That is great. So thank you so much, for coming and talking to us about the vitamins. I know that you offered, you're doing this for your patients, and you are finding that this is something that helps them. With the aesthetic side of it, I mean, we're doing it before the patients are having the plasma. But in addition to that, a lot of the people that are coming to the aesthetic center are actually also getting the IV treatments, right?
Yeah, we're getting busy with the IV treatments actually, and it's becoming very popular. We are actually, the good thing about this is we're getting it firsthand. So we're able to really tell you the effects of it, because, today I came in after the weekend and I was very fatigued today. So let's see how we feel at the end, and then we can talk firsthand.
Yes.
Which is exciting.
That's great.
And fix my IV, just so you know, they're fixing my IV.
That could happen. Gina, unfortunately, does not have very good veins, so...
I'm a child.
I happen to have very good veins. Is there anything else that you feel we should let people know about the vitamins, vitamin treatments?
No, other than most people that do take the vitamin treatments do report that they feel great. They think it lasts about a month, and they feel the difference afterwards, and they feel it almost immediately. How good?
How often can you do
Usually
it?
once a month.
Once a month?
Yeah.
We were at Dr. Arad, remember?
Yes.
In his office. So he's a bariatric surgeon. And what he was telling us is that he's actually doing a lot of treatments for the bariatric patients.
Yeah, the reason is because after his patients undergo surgery, a lot of times they cannot absorb the vitamins. And that can happen naturally anyway, whether you have surgery or not. As you get older, you don't absorb all of the vitamins correctly.
Well.
So this is a way of bypassing your gut.
So you're saying that, will you recommend this to old, elderly patients that are feeling lethargic?
And this is, supposedly, this is also better than just the injections.
Yes.
Because we're hydrating as well.
Yes.
So you're getting the hydration as well, because I see a lot of people come in for the B12 shots in their belly.
Mm-hmm.
And Gina, we're getting our tea.
Oh, isn't this lovely?
So this is part of the service that you get when you come to Transform AMD. We have delicious tea, and the idea is to relax you and listen to nice music and be able to get a treatment that is going to give you energy. In addition to that, it's going to help your skin and revitalize
And
you.
let's also state that if we weren't doing the live show, we wouldn't have all these lights on. It would be a very quiet, serene, area, and we would probably be falling asleep. If
Yes.
this one wasn't keeping me awake, because it keeps me awake, it's constantly talking to me. This is what happens, right?
That is great. Well, thank you, Dr. Middleton. We
Very
really
welcome.
appreciate
Thank you.
joining us.
Okay.
We'll be seeing you,
All right.
sure, very soon. Take care. So, how do you feel, Gina?
I feel good. We had a little problem with one of my veins, so we had to redo it, but I'm in good shape.
And I actually feel a little bit of cold,
Yes,
coming
yes.
through the vein, but
Yes.
it's not uncomfortable at all. For those of you, Gina, let's talk about the PRP, the platelet-rich plasma
Okay.
facial, which for us is something that we know very often, and we talk about it like everybody knows about
Yeah.
the vampire,
vampire
facial, but that is not the case. So for those for the people watching us on
Yeah.
Facebook Live, let's talk about the vampire facial.
So we are big fans of it, and usually what we do is we'll do a vampire facial 1 month, and then the following month we'll do a laser genesis, and this is all for skin quality. So anytime that you bring a puncture or any type of wound to the skin, actually brings collagen to the skin, and your body goes to repair it, and that's really the premise behind it. But this is your own plasma that you're injecting, which is pretty incredible. And what I learned actually was that this plasma is used for everything,
Right?
everything, joints.
Yes.
Not only facial, but joints, all your joints, any type of joint pain that you have, they're using it for women, for gynecologically, to be able to allow you to actually regenerate the area for yourself. So it's amazing what your own plasma can do.
And like we're saying with the vitamins, it actually is a combination that is the perfect combination. And I can tell you, I personally have experienced the vampire facial. I happen to love it. So we try to do it every few months.
Every other month, really.
Every other
you should
month.
be doing it.
But in addition to that, I had an experience with my knee, and I actually did a video on this. My left knee, I have a meniscus tear, and I was in a lot of pain, and
Yeah.
I was having physical therapy at our physical therapy facility, and but it was taking too much time for me to feel better. So our physical therapist Chris recommended, and Dr. Middleton, that I get the PRP, the platelet-rich plasma, and get the injection on my knee. And I can tell you that I am pain-free. Now, that doesn't mean that everybody is going to get the same results, so I don't want it to sound like we found the cure for the knee issues that many people suffered. But I can tell you, I personally, it worked for me. And I had the injection one time. We did it here. Bridget did it, our orthopedic PA. And it was uncomfortable when they were injecting it. But in addition to that, this second day, I was pain-free.
And you lift weights.
Yes.
When you were when I was walking with her, it's like you were limping. I was
Yes.
like, what is wrong with you? And then totally different. It's unbelievable what your own body can do.
I was struggling. I was struggling to wearing high heels, and that for me, as you all know, the people that know me, it is very difficult not to wear high heels. So what I found is that after the PRP treatment on my knee, it's gone.
Yeah.
So I am assuming, and this is something that we'll find out, that the vitamin, getting this treatment also prior to those treatments of the joint treatments for the PRP, would actually benefit.
Yeah.
I know for sure we would probably benefit the treatments for the hair loss. You want to talk about that?
Yeah, that's a definite, and they say it's proven. There have been research to show that your platelets do regenerate hair growth as long as the follicles aren't dead. You know, they say if a man is bald and there is absolutely no live follicles, you're not going to regrow it. It's just not happening. But if you're still getting the little bit of hair and you keep losing it before those follicles die, all men and women, because in menopause, I had it, right? I went through it, where I was losing hair by the handfuls. And then what happened was I actually had it done six times, I think I did it, 5 or 6 times. Done. My hair does not fall out anymore. So it's just amazing what PRP can do.
In the, like you were saying, I mean, the PRP treatment for the platelet-rich plasma for the hair loss, I know is helping a lot of women. We are doing it here, and I can tell you that it is amazing the results that we're seeing on, especially for women, because women, unfortunately, we have it harder than men, because when a man loses their hair,
they look handsome.
It's okay. They look good and they look handsome, and it's something that we are all very used to. But for a woman, as she's losing the hair, and it happens, like you said, with menopause, and sometimes when you have the bariatric surgery too, when you lose some of your,
could be one of the side effects.
Exactly. So being able to have that treatment is a great treatment for those people that are suffering from those conditions. And I know you started talking about how the PRP is also being used for women that suffer from menopause, which is it's a huge problem for women, where they lose their libido, or they lose
dryness. It hurts. The pain of having sex. This actually is one of the cures.
Yes, and they say, I mean, in combination, and we're gonna have a show actually on this. So we don't want it.
Sex talks with Gina and Maria. No more reflectory sex. We sex talk.
That is going to be a very interesting show.
And just so I'll share that I'm actually going through the treatment myself, because I'm in 5 years of menopause. So I'm actually doing it. So all these things that we talk about, it's going to be from experience. And we're not going to tell you something of what we think. It's going to be actually what's happening and what effects and results that we got personally from it, which is going to be exciting. Yeah, very exciting.
So anyway, so we are doing the treatment. As for those of you that actually just joined us, Gina and I are getting
Reflect and Reset with Maria and Gina live on Facebook.
Yes, and we took a little break there for
2 weeks.
Was it 2 weeks?
Yeah, about 2 weeks. 2 weeks. Yeah.
I thought it was a little longer than that, but we took a little break, and we decided we're gonna bring the show to you from our office, and we're gonna bring you so many different topics, very exciting topics, and we are very, very happy that you are joining us. And if you have any questions about vitamin C, vitamin B, or the complex, you could always reach out to us at Forme and Transforme, and
inquire. And we're running a special.
Oh yes, actually, we are. I forgot about that. So Gina, tell them about the special.
Why don't you tell them about
the special?
Okay. Since they keep training, but we know what the special is.
So for the month of August, and believe it or not, it's already the 20th of August.
Oh my goodness,
it's pretty crazy. We are doing a special, which is $80 for the IV treatment. And we are $80, right?
Yeah, $80.
And then with the combination of the IV treatments and the PRP, it comes out to $440. And the savings is about, tell me, what is the saving for the...
I think, well, I know that a regular PRP is $400.
Can we see the brochure?
I think it's $400.
It's okay, we're live, you know, this is...
It's
Gina, I can't see, can you see? So you will tell.
No, so it's $440.
And so what is the saving?
Well, we know that the PRP is $400 normally, right? And we're doing it for 2. And then the 2 drips is $80 each. right?
So it's a major savings for
I
this
think
month.
so. Yeah, and we are very excited about it because, and we're starting to get a lot of people calling about it too.
Yeah.
You know, it's so good, and not only, like you said, is the drip great for everything, for us, right, for the way we feel, but also it's going to enhance the PRP.
Yeah.
We're going to be looking hot, right?
Very hotter than we are.
Hotter than where we are. I'm ready to rock and roll.
So, you know, we get so creative in our center that I realized that our Sandra, the director of the aesthetic center, is actually doing facials, and people are getting their treatment at the same time. Isn't that great?
Oh, that's smart.
That,
oh, yeah.
I was.
Oh, you're laying there.
While you're laying there,
Great idea.
you're already spending 45 minutes to an hour on getting the treatment done. And
Smart.
that's very smart.
I didn't even know that, just so you know. I didn't even know that. I'm going to do that my next facial that I have. I'll have my other treatment.
I know.
Dr. Middleton said that we can do it once a month. I think that, if I'm not mistaken, I think you can do it more than that. But you know, it's usually you should like to do it once a month to keep that, you know, to
Yes.
keep the vitamins in your bloodstream and to keep it flowing. But I know that we do have patients that come in every other
The
week.
protocol that Sandra was talking about is 1 week you get the drip and the vitamin. The next week you get the vitamin again, and then the following week you get the PRP.
Got it.
And she says the results that you get is amazing.
Well, we're going to find out, right?
Yeah.
I'm looking forward to doing it.
And you know, with exercise, I'm looking forward to this because I know, you know, I get up very early most of the mornings to work out. And lately, like today, I had a hard time waking up, and I am hoping that definitely this treatment is going to help us out.
Gives you a little boost.
Yes.
Well, I know it's not going to help me out because I ain't getting out of bed to exercise. But we all know that, right? So
All right. So how
this is
are
our
we
first
doing?
show. It's our first show, and are we winding down already? Is that no? We still have time. Great.
No.
Okay.
All right. So what else should we talk? Let's talk about something else. Let's bring something else up about.
So,
about ourselves.
be careful with your IV,
Uh-huh.
woman.
Yes, it's
Gina forgets.
it's in a good spot right now. So it's
Does it hurt?
It doesn't hurt, and the treatment, I gotta tell you, even Gina that has difficult veins,
very difficult.
and the treatment was not painful at all. For me, I have easier veins, so
Yeah.
it's as you could see, and I'm able to move my hands. I'm a little cold here. That's why you see that I have the blanket. Gina,
No, I have hot flashes.
she gets hot flashes from.
I should be ripping off this very soon.
But it doesn't hurt at all. It's very comfortable.
Yeah.
You have your tea and you
I'm
relax.
actually I think I'm having an international coffee.
You're having international
Yes, I
coffee.
believe they brought me a nice international coffee.
And look at this pretty cup.
Cool, with a little butterfly.
So we try to give you unique teas and unique coffees.
Yes, different
And,
international types of teas.
Our goal is to really make you so relaxed that you don't want to leave here. So
This needs to be your the place of where you can reflect and reset.
reflect and reset.
And you can get yourself going so you can get back to those kids and back to the husband and back to work and back to your everyday life.
I can tell you one thing that we should really have patients do when they're doing this treatment is meditate. So the next time that you and I get the treatment, because we need another one before we get our PRP, we could take meditation for a few minutes, 15, 20 minutes.
Yes.
I was obviously the benefits of meditation is that you're able to relax and you're giving your mind a rest as much as possible and rejuvenating your mind, and to be doing it at the same time that you are injecting something good is going into your body,
Right.
that is going to make you feel
Well, if
good.
I'm not mistaken, you meditate whenever you have you have
Yes.
the needles done in your face. The vampire facial, she meditates.
Every procedure that I would have, that is going to be painful, I put
And
my
don't say painful,
meditation.
it's not painful, it's a little uncomfortable. A
Uncomfortable.
lot of them are uncomfortable. I wouldn't say painful, because if they were painful, I wouldn't do it.
Well, I'm not talking about just the
No,
aesthetic,
I'm
okay?
But-
I'm talking
But
about.
it really is, but you meditate and then it
I
kind of takes the
meditate.
edge off.
Absolutely. People tell me I am the best patient because normally whatever procedure is going to make me uncomfortable or painful, I find meditation completely it relaxes me. I even use it when I go to the dentist, believe it or not. And at the beginning, I was a little concerned because I thought people would think I'm crazy because I'm always saying, do you mind if I put my meditation? So I use guided meditation.
Right. I did it last night actually, to
You
sleep.
did it last night.
I was so
Yeah.
wound up I couldn't sleep, and I put on the deep sleep meditation, and I actually fell asleep after about, probably not after the first round. I had to do another 10 minutes to really sink myself in, and then I finally fell asleep. But I didn't think I was going to fall asleep last night.
Oh, the meditation works.
Yeah, it really does.
It's something that I started using with my 10-year-old daughter. So last night we were doing this meditation that's called loving kindness, which is my favorite meditation. So imagine coming here, getting your IV treatment, meditating to loving kindness. So you are going to love yourself, you're going to be kind to yourself, and then you are kind to other people. So we, this is the perfect scenario to be able to relax. So
And yeah, and again, and the lights are on now because we're taping, but besides that, it would be a very dark and cozy. I think that was the word, last time we had it, I think I almost fell asleep. Remember
we
when we
did.
get the IVs the last
Yes,
time we were in here?
yes.
I actually fell asleep.
All right, so Gina, my partner in crime.
Yeah.
We are back. So the ladies are back.
Yeah.
Reflect.
With interesting topics coming.
Yes, reflect and reset with Maria and Gina. And we are so happy that you've taken the time to actually watch us and listen to the things that we're bringing to you. We really value your time and we thank you, and we're going to see you next week. So we are actually at a different time now.
Yeah,
so
now we're Mondays at 6 o'clock, every Monday at from 6 to 6:30. So we're live on Facebook, no more WVOX right now, until we start our own radio show. And our podcast, right? And we're going to look to do a podcast
yes,
eventually.
we're looking into many things. But for now, you got Maria and Gina, Reflect and Reset with Maria and
There you
Gina.
go.
Thank you. Bye-bye.
Bye, everybody.